Welcome back to the PFC Podcast. The views and opinions you are about to hear are the speakers and do not necessarily reflect those of anyone else. Now on to the podcast.
Welcome back to the PFC Podcast. This is Dennis, and today I'm with Rick. How you doing, Rick?
Doing well. How are you?
I'm doing pretty good. And today we have kind of a downer topic, but it is really important, and we've never covered it. So we're going to do it today. It is what to do with your patient after they die. And, we've gone over palliative care, and obviously this is not something that we want to ever have to deal with, but I think it's dumb to not know how to do it. Let's start off with a local patient. For whatever reason, the patient has expired. How do I even begin?
Okay. Well, the first thing is, it's always difficult losing a patient. Somebody you've invested that time in, and it's a human being, all that. It's just kind of hard to process that sometimes. But it does happen. If you do medicine long enough, you're going to lose patients. So with a host nation, say a host nation civilian came to your clinic, something happened. The biggest thing is knowing the cultural norms for how to show respect to the people, to the family, and how they process their dead. So basically what you're going to do is you're going to do everything you can, but you want to prepare the body in a manner that is most respectful to the culture that you're in. And then basically that, if there are any local authorities that need to be notified, you have to, do that, tie into the local system if there is one. And then ultimately, let the families deal with that. So part of that is, speaking to the families and, being able to convey that, hey, we did everything we could, but this happened. We're preparing them, the body for you. What are your wishes?
Right. Obviously this is not something that we're taught in our medical courses, but speaking to the family about somebody who's expired, just from experience, you don't want to be crass and straight to the point, but also you don't need to belabor it. You don't need to over dramatize the story in your efforts. But being fairly upfront, you've done this effort and it didn't work.
I kind of try to read the audience, so to speak. I try to, the people you're speaking to, kind of gauge off of them, off of how they're reacting, and as far as how much info they require. And again, you have to be kind of aware of the culture that you're in and what those cultural norms, and don't cross certain lines.
Right. Because definitely some cultures are overly, what we would consider overly dramatic, wailing, throwing themselves on the ground, things like that. And then 10 minutes later, everybody kind of dusts themselves off and they get up and go back to doing what they're doing.
Yes, and some cultures are very stoic, and you may not get much of a response, and you see everything in between.
Right.
So just kind of understand, like I said, the culture in the area you're in, and be respectful. That's the biggest thing is, they just lost someone. Understand that that's an emotional event for them, whether they show it or not. It is an emotional event, and that means it's an event that can potentially blow up in your face if you step wrong.
Right.
So
definitely put thought into, before you get the family, don't just pick them up and drop them in a corner, right? Just imagine yourself walking in and seeing your own teammate like that. We would be, livid, right? So take some, precautions as far as care and respect, getting a blanket or something like that to cover the body. but to get it out of the working space, get it to another place where the family can now be brought in.
Yes, definitely. And, some places they may have funeral services and all that, but it's always good you definitely want to include the family, bring them in and let them know what happened and kind of take the cue from them as to, disposition and all that. But yeah, you're right. You have to get the body out of the workspace because work continues. And I would say that, depending on what the local laws are, kind of know that because, like for us, we want to leave all medical interventions in place in certain instances, so that can be looked at and determine, anything that contributed to cause of death, and so to speak. So, do they have a legal requirement for that? If not, then if it's going to be released to the family, the body, then you may want to remove all medical interventions so that the body is as prepared as possible for them to do whatever their end of life process is, their burial process, or whatever their cultural norm is for that.
Is there any paperwork or reporting that we have to do to hire?
Yes. I mean, that's usually unit kind of SOP, but any host nation death, I think you should report to hire, and it is in your best interest as a medic to do so. And here's why: because if something happens, you don't want that to blindside your command. So you should let them know so that you can have a little bit of top cover. If the family leaves, everything seemed okay, but then after a day or so, somebody's talking in their ear, or maybe somebody that doesn't like the U.S. and whatever, and put some ideas, and they launch some sort of complaint. You don't want that coming out of left field. You also want to make sure that maybe you do a quick 600 on what happened, record what happened. Anytime you should be doing it anytime you do medicine, but a lot of times we don't. And I get it, man. We're busy. Guys on the teams are busy doing everything except medicine until you need somebody to do medicine. So record keeping isn't always the best. But if somebody dies, you should have a record of what the treatments were and what happened. And that is, sadly to say, to cover yourself, but also, you'll find later on, it's a good record. We should be recording these things in the JTS, their database. So even with host nation, or host nation locals, partner force, and U.S., we should be recording all of that, and it should go into the JTS so that we can use that for research data, and we can learn lessons from that. And, and I think we're just now starting to get halfway decent at that. But I think we can still do better.
Yeah, of course.
Definitely you want to notify hire, and you want to record that event and have a record. If 6 months from now, somebody comes and talks to you, you may not remember all the details of that event, and to have a good write-up that shows that you did everything you were supposed to, everything you could, will go a long way.
Yeah, I think you're right on that. Now everybody has their own experiences. Locals passing for whatever reason. Has there been a time where you've been kind of caught off guard as far as not being prepared or not knowing, maybe a cultural issue that's come up?
Well, I know that the first, there's been many times I wasn't prepared. Holy cow. I think I spent most of my time being unprepared. thinking, hoping, and then finding out I was woefully unprepared. So, I mean, the first time we hit an objective and had enemy KIA, we had no plan, no plan, what to do with the bodies. So it never crossed our mind. So I had a team leader. He's like, "Hey, what do we do with the bodies?" And I didn't have a good answer. So, kind of flippantly, I said, "Hey, we got to take them back with us to, so the locals can process them and whatever. So let's strap them across the hood. And when we drive through town," and he just looked at me, his mouth open, eyes wide. And I'm like, "No, man, we're going to leave them here. The locals will come in and they'll take care of their dead. Yeah. We're going to leave them here." But I never thought of it. And I didn't know if that was the right answer. It just seemed like the right answer. And to be honest with you, what I did is I went to my terp. I went to a terp that I trusted. I said, "Hey, man, what do we do?" And he's like, "Just leave them here. The locals will come in. They'll take care of them." Yeah. I'm like, "Are you sure? I don't want to piss anybody off. I don't want to, we're already having conflict with some of the locals. Right. They're trying to kill us and we're killing them back. So, I don't want to make this worse." Right. And he said, no, that's
how it's done.
How it's done here. Like, okay, all right. So, definitely rely on the locals you're working with for advice.
Yeah.
Your partner force, your interpreters, build that relationship and build some trust. And believe me, asking those questions is going to show that you give a crap. Yeah. And it's going to go a long way to building that rapport with those folks you're working with.
Yeah, that's always good advice, is just building some kind of rapport, and asking questions, right? It's just going to just kind of build that relationship. Like you said, it just shows that you actually care. Now, locals are kind of one thing, and we can kind of insulate ourselves from that. Now, what about, Americans, or God forbid, our own teammates? And putting in heroic effort, but sometimes it just doesn't work out.
Yeah, I mean, that's absolutely devastating, but it happens. It happens with our partner force. It happens with our teammates, and these are people that we're invested in, that we've spent time with, that we care about. So start with the partner force. Again, you're going to follow their norms, and you're going to bring them back to base. Yeah. You're going to do everything you can to recover them and bring them back, and let their unit process them in the manner that their culture dictates. For a U.S., I mean, we have our own policies and our own regulations. Graves registration has a whole reg that covers all of that. In the Army, all of that falls under the S4. So it falls under logistics. Once a person's deceased, it's no longer a medical issue. It falls under logistics by regulation. So that's movement of, the deceased falls under the S4. And, but they always ask the medical folks for, hey, so for us, any U.S., we left most, except for sensitive items, we left most of their gear on them. Any interventions we left on them, and they would go get processed through Graves registration, and then they would get flown to Dover and get processed there. And, they go through collecting all the data. Right. And we use that for, that gets put in the database, and you can query. That's where we found out that Needle D's guys, in what used to be the primary spot, second ICS, second intercostal mid-clavicular line, that there were a lot of failures to get into the pleural space with a Needle D, was from the data that was collected post-mortem. So our dead get processed. There's a whole procedure, a whole group of people that are amazing that they do this. And I can tell you, it's horrible.
Yeah.
Putting one of your teammates, one of your friends into a body bag, trying to decide, okay, I need his radio because it's a sensitive item. I need his weapons. I need, I'm going to take his ammo. I'm going to take his, grenades and stuff. But his body armor, do I leave it on him? Do I take it off? Mm-hmm. So in our case, we left it on him.
Right.
We took, all the pertinent gear off of them and we put them in there. But I mean, it's a horrible thing to have to do that, to make those decisions, to try and think when you're in that situation. And then, having to sit there, because the medevac, didn't have room for him. Mm-hmm. So we prioritize the living over the dead, rightfully so. So now we have to wait, and how do we get him out? So another bird has to be sent out, and we're waiting, and, here's his body, and you get the whole team there, and everybody sees this, and there's emotions are raw, and, that's a recipe for bad things to happen. Yep. It is very easy at that point to say, hey man, let's go do the village.
Yep.
And you have to fight that urge, that anger to just lash out because you're in pain. So, you have to have good leadership to make sure that doesn't happen, because that doesn't do anybody any good.
Right. Now, speaking of leadership, I would definitely think it's a smart idea to contact your doc, battalion group, whatever it is. Yeah. Your next hire provider, because one, like, how do you even confirm death? Like, as a Delta, like, other than blatantly obvious things, we can't confirm death.
Well, that's kind of changed over the years. They went through this whole phase that we were not authorized to pronounce death. Mm-hmm. Okay, but his head's missing. Right. Come on, man. And then there was the whole thing with the medically retiring guys, so the family get benefits, and they fixed all that, thank goodness, because we were, doing notional CPR, right, to keep the guy alive so that they could medically retire him, so his family got the benefits they should be getting anyway, And so when I say notionally CPR, we're doing CPR, but with no hope of success.
Right.
You're doing CPR basically on a corpse. And, but, all of that, they kind of fixed the regs on that. So, while we're not officially pronouncing death, we can recognize it and terminate efforts. Yep. And, sometimes, especially when you have multiple casualties, you have to prioritize who you treat. Yep. And if that guy looks dead, maybe you walk to the guy that doesn't look dead but looks messed up, that maybe you can do something for, right, and go help them, then come back and double check, verify. Unfortunately, that's just a reality of things. When you have one or two medics on a team and you have an event that produces multiple casualties, you have to sort things out pretty quick.
Yes.
And so you can maximize efforts for the people you can save.
Yep.
And that's a hard choice, and you got to live with that. And you'll always second guess that through the rest of your life.
Right.
You'll always look back and say, well, what if I would have, but, at the same time, you have to come to grips. You did the best you could.
Right. That's what I was saying, reaching out, like, even though you have a really good idea of what the outcome's going to be, just reaching out to that doc to tell you, because I've had this before, you reach out and they just tell you, look, stop. You need to continue working on other people. Just stop. Well,
at one point, they preached that we shouldn't do CPR on the battlefield. Yeah. And now it's like, no, you're going to do CPR even, for the psychological well-being of your team. Yeah. And I get that, because I never, you're going to try everything you can, and you know, you're going to do everything you can for your teammates, but there are limits. And so, I mean, notifying your doc, I mean, it depends on the environment you're in. If you're on a JSAT or something like that, yeah, definitely. If you're on a combat patrol, you're going to call up to, you know, your SOTF, CDSOTF, whatever, and they're going to know. You're going to rattle off, hey, we got, you know, 1 KIA, battle roster number, and your doc's going to get notified.
Yeah, he'll be there in the SOTF.
Yes.
At least that I've noticed. Anytime there's a tick, they show up.
Yeah. And then, so they'll get notified that way. But if you're looking for medical advice to terminate efforts, that is a resource that is going to do two things. One, having that other person, that higher medical authority, tell you, even though you know that this is, he's gone, but to have that higher medical authority tell you it's okay to stop. That does that's great psychological support for you and also for your team.
Yep.
So they're like, okay, this, higher told him to stop because it's okay.
It's over.
Yeah. Yeah. The onus, the bad guy isn't you, the medic now.
All right.
If there is any, harsh feelings, but, that's the other thing is you have to deal with the after effects of that. So even though you package up your guys, you do as respectfully as possible. I mean, I've seen guys that carried an American flag, and they would carry, like in Afghanistan, an Afghan flag for our partner force, and we carried body bags in each of the vehicles. So that was a great decision, something that, like on my first trip, I had heard other people doing that, and I decided to do that. And it was fortuitous because now when we lost someone, I had the means to, collect up the body or the pieces or whatever, and had something to put them in. And, if you have their nation's flag to put in there with them, it's a sign of respect. So that's an idea that, I mean, I didn't think of at the time, but I've heard other people do. So have a plan for that. Hopefully you never have to use it, but if you have a plan and it's respectful to their culture, to yours, it's something that, the team will appreciate. The people you work with will appreciate that you had the forethought to have a respectful way to package up our teammate and then send them on their way. And then you have to look at, okay, once we get back from patrol, once we get out of that danger area, we've got to deal with this. I can tell you personally, I had the team get together, and we talked about it, and it was very difficult and very emotional. And it was like, dude, we got to talk about this. We got to let this out. And unfortunately, it takes somebody being the adult in the group. And if you're the medic and you're calling the meeting, that's you. So don't forget that after they unload, you need to. If that means you go out to the bunker and lose your shit for a little bit, that's what you need to do. And it's not a one-time deal. The shit comes back, and it accumulates over time, and you have to deal with that. So when you can, you get back and you find someone, that therapist or whatever that you can go see. And just like you would when you sprain your ankle, your knee, you go to the physical therapist. Well, this is the same thing. You go get, yourself straight and figure out how to deal with this, because you're going to be asked to go out and do it again.
Yep.
And so that's part of. And if you're going to encourage your guys to go get help, which you should, you need to lead by example and show them. I was kind of late coming to that realization myself. And I suffered for it.
Yeah.
So understand that. What we haven't talked about is, okay, here we've got all these assets to get our guy out. what happens when you can't?
Okay. Well, let's see. So like a scenario we had, and again, it's a scenario. But in the scenario, one of these local patients dies. There's a injury that there is nobody on earth that was going to fix it in that situation. And so talked about, being respectful, blah, blah, blah. But then the topic of weather showed up, and it's 412 degrees outside, and the body's processes start doing their thing. And that was another thing that people weren't thinking of. I mean, obviously, there's an emotional toll, but there's also kind of a preventative med, or however you want to call it. Like, we have to take this out of the workspace because, one, it's just horrible to work around. But two, like, you're going to freak everybody out when
he starts bloating, gases start escaping, tissue starts rotting, insects start
doing their thing.
All the physiological processes that happen to the decomposition of a dead body,
right,
are going to happen. And you can delay them, you can slow them down with temperature. If you have a cooler, you can put the body in. But some people get freaked out having their food and a dead body in the same fridge.
Right. Move your sandwich. Yeah.
Okay, we're all having ice cream tonight because I had to clear out the freezer. Seen that in the movies on the ships and whatnot. But
so obviously, this is at this point, like, we've already pushed up the KIA report. Like, everybody knows it's just like you said, it's a logistical problem right now. Do you think there's a problem with a temporary burial?
So I would say with the host nation, check with them, and make sure that is okay culturally, with them, include them in that decision-making process. For us, it is definitely part of our doctrine. Mm-hmm. So in a like UW scenario, I mean, that's part of our UW doctrine, is to cache a body, a fallen comrade, and do a 10-digit grid. And there's a thing called an underreport. There, with a sketch, with a major terrain feature, distance, direction, 10-digit grid, all the details and you send that up encrypted. That was in the old SAF Sup back in the day that the commo guys had, but that's still a doctrinal thing, an underreport, to send up, hey, this is where our fallen guy is. And as regular forces, the FLOT moves forward, because we're, if we're doing UW, there is no FLOT.
Right.
We're
beyond it.
Yes, way beyond it. But when conventional forces come up, the idea is that doctrinally, once they secure that area, they can retrieve that fallen comrade and take him back in and take them and process them with all the respect that
they deserve.
Yeah. So that's if we don't have all those assets to get them out, that is a doctrinal technique that I don't know if that's really covered much in the Q course nowadays. I don't know. I'm not, privy to every aspect of what's in the course right now. I have a fair idea of what's in the medic course, but not the whole Q course. So I would hope they still cover that. Like at Robin Sage would be a good place to do that. And so
other than kind of like our internal logistics of sending up our reports, dealing with our own team's emotions, personal emotions, kind of like a hygienic, taking care of the body, is there any kind of reporting that's due other than our T-Tri-C card?
I would recommend doing the 600.
Okay.
I would want and you don't have to do it right away. You can wait a day.
Yeah.
But within a day or two, mission dependent.
Of course.
When you have some time where you can take a breath, write up everything that was done. And that's going to be important for record keeping, of course, for research, it would be good data, but also, for CYA, of course, but later on, as time passes, and how every time we remember something, we're rewriting that memory, and there's drift over time. To have that written record that kind of brings you back to baseline on that memory and everything you did, especially when you start looking back and you feel guilty, that survivor's guilt.
Yep.
Reading over and seeing all the things you did, like, okay, all right, well, I've started to stray and started to blame myself, and here I'm seeing that, and I'm seeing that, I did everything I could. I had multiple patients. Maybe I could have done a little bit better, but honestly, that wouldn't have affected the outcome. This is, and when you look at that, when you look back on it, look at it in context as a whole. Not just what could I have done to this one guy if you had 3-4 patients. What was going on? I can tell you in Afghanistan, our first trip, we were there about a month, a little over a month. A couple weeks prior, we had another team hit an IED. We lost 4 friends. It really messed us up. And then 2 weeks later, we hit an IED. We lost 1 guy, but we had multiple injured. And having to deal with that was, for one, being the only medic there, I had to deal with the casualties, our fallen comrade, and then it dawned on me while I was treating them that one of them was the team sergeant, and I was the next ranking NCO, and nobody was taking charge. Everybody was doing what they thought was right in their own, like this vehicle, the guy in charge of that vehicle was in charge of that vehicle doing what they thought they should. This other vehicle was doing this. That guy was in charge doing it, but nobody was overall in charge. Yeah. And so, some quick instructions, divvying up force, go back to treating, get the medevac, do this, and then, process our fallen comrade and, our teammate. And at the time, at least for my part, I felt numb, which was probably a good thing.
Yeah.
It allowed me to function and to kind of machine through, okay, here's what needs to be done. Boom, boom, boom. Here's a task list. Hey, I need you to get security up there, get one of our vehicles back at a time. Let's strip everything we can off the blown up vehicle and then get them back out there, have them relieve each other, get the Afghans here and here to provide security. Boom, boom, boom. Shut down this road, do this, do that. Hey, team leader, call higher. Here's what we need. I need a medevac. Fill out the medevac card. I'll give you the information. I'm tying bandages. And, let me know when you're done with that. Let me know when you're done with that. And then you try to sort it out. And, it's not by any means, it's overwhelming, but having your that numbness, that didn't last.
Right.
All the anger that other guys, it all expressed itself in different people at different times, and having to try to keep an eye on that so that some really tragic things didn't happen. Some things that would have had long-lasting legal effects, and they didn't. The guys were, but the emotions were there. Yeah. And I can tell you that changed our team. It changed a lot of things that we were a lot angrier, and we were a lot more aggressive. And it kind of took the blinders off. I don't care how much preparation you do until it happens, until you lose someone, until you have those casualties and whatnot, those people you care about get hurt. There's no way to know ahead of time how that's going to make you feel.
Yeah.
And you're going to have to process and deal with those emotions and try to keep your humanity.
Right.
Try not to go total beast mode. There's a time to let the dog off the chain. Don't get me wrong. But knowing when that is, and I don't know we ever totally let the dog off the chain. That would have been like horrible, but to at least loosen the chain a bit, and pull it back in, so to speak. I know it's all metaphorical, but we got a lot more aggressive after that, and I think the guys needed that. They needed, someone to sit down and say, "Hey, check it out. Okay, something bad happened. Now we're going to go to work and we're going to make them pay."
Yep.
And I think psychologically that was necessary. Yeah. So we're going to make them pay, but we're going to do it smart. So give me a target list. Right. Let's go after them. Let's start hunting. Here's what I want. Yep. And we did. And I think that helped psychologically, that there was okay, this thing happened, but we're going to address it. Yeah. We're going to work towards, resolving it. And did it resolve anything? Not in the big picture, but for us, for our AOR, for the time we were there, it did put the enemy on their heels. Mm-hmm. It did have an effect. And it wasn't just our team, our company on that rotation lost 9 guys. Yeah. For an SF company, that's a lot. Over half the company was wounded at one point or another during the rotation. So it was very exciting time. Right. So other teams were feeling that. We had out at Firebase Cobra, we had 2 ODAs. By the end, there was 1 ODA, mm-hmm. with members from the other 2 put together. They suffered that many casualties. So, having to deal with that, those medics out there, I mean, we're doing amazing things. But when they lose guys, they have to process that. And, part of that, hopefully is, keeping the records, writing down, documenting that stuff, taking care of your guys, taking care of yourself. Mm-hmm. You've got to figure out how, a time to let that out. Yeah. Let those anger monkeys out. Yeah. And,
well, there's a lot to, like you said, your team got recentered, refocused on the mission at hand. So that allowed them an outlet in a smart way, as opposed to war crime, right?
Yeah. We want to avoid those. Right. And there's multiple reasons, not just the legal reasons, but the moral, ethical, and the practical reasons. Yep. It doesn't do our cause any good if we go out and do that.
Right.
You can't make friends when you desecrated the bodies of their neighbors.
Right.
You tend to increase recruitment for the other side.
Yep.
So.
Yep. So other than, the psychological aspect, sending up your T-Tri-C card, maybe sending up a 600 later on, is there anything else that we need to know about how to process a body from the team going out? Like, is there a timeline for evac on those? I mean, I would imagine it would be.
I don't know if there's the evac's going to be a routine. Yeah. It's not going to be a priority or urgent. It's going to be a routine. Routine's within 24 hours. Yeah. Which is hugely different if you're at your fire base as opposed to when you're on patrol. 24 hours on patrol is horrible. Yeah. But I've never seen it take that long when you're outside the wire.
Right.
It did take maybe a couple hours. But then, that one day it took an hour and 37 minutes to get a medevac.
Yeah.
So an hour or two later, having a bird come out to pick up a body, okay, we're still processing the area, trying to, figure out what we're going to do with this blown up Humvee, strip everything usable off of it, and leave as little as possible for the enemy.
Right.
So, as far as timelines go, it's going to be very asset dependent. So the sooner you can get the body out, the better for everyone.
Yep.
Every time you walk by, I would see guys walk by the body bag and look at it, and you'd see their fists tighten up, their jaw clench. You see the anger every time they walk by. It just built on that. So, I mean, there's that aspect of it. They're not going to risk life and limb to get them out, but they'll send somebody if they're available. If you're at your base, you want to get the cadaver out of everyday passage, out of sight. Put them in a private place, someplace that guys aren't going to be reminded as they walk by. Let them kind of get back into their day-to-day duties, and then when you have time, you'll deal with the other aspects of that. But you don't want that constant reminder.
Right.
So I don't think there's a set timeline, but it is a routine evac.
Yep. Cool. Well, thank you very much, Rick. I know this is not our normal happy podcast, but I think it's super needed.
Yeah. And I'm sure there's a bunch of, I'd be interested to see what other folks' take on this is, but, I mean, that's, in my experience, and, I mean, that's pretty much how we've handled things. And I think doctrinally that kind of lines up.
Yeah.
So.
Cool. Well, thank you.
All right. Thank you.
That's it for today's podcast. Make sure to go to our website, www.prolongedfieldcare.org. Check out our free downloads and a ton of other helpful information. Grab a bag of our fresh roasted PFC coffee, links in the description below, and stay on the bleeding edge of combat and austere medicine. This is Dennis for the PFC Podcast. Out.